For example, what we call, you want to pick a PI cover, professional indemnity. They're told, we need your designation, where is it? So there are small things that really matter. And at the end of the day, it becomes a mall. And when we do that, what are we telling our people? You don't need to go back to school to study, because when you come back, nobody recognizes you. If every one of us took a step and said, I'm not going back to school, what will happen? What will happen to our service delivery? The people retired will go home. There'll be a big gap. Okay, and then there will be mismanagement. So at the end of the day, it's a vicious cycle, and then it will come to haunt each and every one of us, no matter the status you have in the country. So what we want to tell the government is that let us have systems run. Let them not run on one side, and all these other sides, they're all dormant, because time waits for no man, we say. Yes, thank you.
I'll give you a perfect example. The other day, we are struggling with Ebola. And was it today or yesterday? I've seen Uganda saying that it's now free. Ebola free.
It was yesterday.
Because it was actually yesterday.
Yes.
In this country, we are still grappling with the same issues to do with the emergencies and actually epidemic preparedness. And I'll give an example of public health, because PHOs are actually employed at the border points to be able to take care of issues to do with the screening of travelers, issues to do with the surveillance, for example, disease surveillance, for example. If there's an outbreak of cholera or whichever nature of disease, and any communicable disease, there's actually an issue of disease surveillance, and also issues to do with trying to ensure that we contain the outbreak. But you know, we cannot do that because we are actually very few. The healthcare workforce is actually very few. Even if you were to put up isolation centers, even quarantine centers in this country, they will not be of any value to us, because the people who are supposed to be working in those isolation centers or the quarantine centers are not there, and therefore it becomes a problem. Even to service delivery to a patient, the timely, the waiting time a patient is supposed to be served. Actually, our facilities actually, I've seen patients who die at even casualty areas, not because they want, healthcare workers want to, but because they're actually overwhelmed. So what we are saying, the same spirit that the national government had by employing 56,000 teachers, because we are aware, we live in this country, the government employed 56,000 teachers. Police officers are being employed on annual basis. The same spirit, we want to see it in the healthcare. We want to see close to 100,000 healthcare workers being employed so that they can be able to address issues to do the epidemics, PHOs, nurses, clinical officers, and doctors, so that we can be able to at least be free, be able to be happy when you're actually talking about our healthcare system. But with the politics and with the push and pull of our two levels of government, actually what we are seeing is supremacy wars. Each government that seems not to understand what is the actual role in all this issue. And it is important, it's high time that now we need to understand, if another government is not actually taking its role seriously, the counties, the health now should actually be reverted back to the national government, that we can be able to see Kenyans get the required healthcare services that they need, because it's a right in the Constitution of Kenya 2010. Article 43, it's actually a right. Curative, preventive services is a right to our Kenyans. And what we're actually asking is not a favor for the government to do us, because we pay taxes, we actually have gone to school, we need to make sure that we offer these services without any disruption whatsoever.
So, Christine, is that to say that you're not satisfied with the government's response so far?
No, with the national government we are, but the counties, that is where the whole problem arises.